or getting a bad grade because you want to cram. Don't do that. Who got time to read all this stuff in nursing school, okay? Sending love, health, happiness, and prosperity to you watching this video. Welcome or welcome back to my channel. My name is Dr. Aisha. I'm a family nurse practitioner. And in this video, I'm going to tell you everything you know, how to pass nursing school, how to thrive in nursing school, how to survive nursing school. The number one tip you need to know to thrive in nursing school is you must be organized. There is absolutely no exception. You have to be organized. I say get you a big like 8x10 planner calendar, and at the beginning of the semester when you get your syllabus, highlight all of your assignments when they're due. Transfer all of your assignment due dates, whether it's a quiz, test, discussion board, paper. Put all of that in your planner and highlight. And I will put a picture here of how I did mine when I was in nursing school. But you want to use that planner to pretty much schedule all of your time. Plan out all of your time. You want to plan out your study schedule, your assignments and test dates, your clinical days, and then your life outside of school. I don't believe that you can't have a life outside of nursing school. I think with proper organization and time management, which writing everything down, planning out all of your time, that's going to help you with your time management. That is going to help you be able to have a life outside of nursing school. The second tip is you need to prepare. If you are watching this and you're about to start nursing school, brush up on your anatomy and physiology. Brush up on the A&P, because understanding A&P, the normal A&P, that's going to help you to understand when the body doesn't work normally. It's going to help you understand it so much better. So don't take A&P lightly. Take it seriously, and read up on your notes on A&P before nursing school. But once you get into nursing school, you need to be preparing before you go to class. And what I mean by that is you need to be reading up a little bit on the material so that you kind of already have an idea on what the professor is going to go over in class. That way you're not totally lost. It's going to help reinforce the information that you've already read, and that's going to give you an opportunity for you to ask questions in class if you're unclear about anything. So if you don't want to read your textbook, because I know that the textbooks in nursing school are humongous, reading them is boring, and the reading assignments are like, who can do that? It is like unrealistic, right? All these chapters they give you to read, it's like, wait a minute, I mean, I only have 24 hours in a day. I sleep for 8. I gotta do clinical. Who got time to read all this stuff in nursing school, okay? So what I recommend is you getting this Saunders book. This is the 6th edition. I don't know what's the latest edition, but I used this when I was in nursing school. So read over whatever you're going to go over in class. Read over in this beforehand and take the practice questions that correspond with the reading material. That's going to help you. That's going to put you ahead of the game. And while you're reading this, it's also preparing you for your NCLEX. So you need to get this before you go to nursing school. Pre-nursing students, I want you all to kind of focus on these issues, these subjects right here. But as you can see, this literally goes over everything. Everything that the NCLEX is going to test you over, this goes over it. Here's the other page. So there's nothing that this book doesn't cover. Again, prepare before class by reading the material in this book beforehand. The third tip is you're going to have to study. There's absolutely no exception. You are going to have to study. See if you can record your lectures from your professor. And if you can, that's fantastic. What I recommend is that you go home, study the information that you learned in class, study it the same day. That's going to help reinforce the information that you already learned. So this is going to be your third time hearing it or reading it or studying it, because you have already done your due diligence and you've read it in the Saunders book before class. You went to class and then you're going home. And I'm not saying you have to study for hours after you've heard the lecture, but you need to be studying a little bit that same day. That way it's still fresh in your mind. You need to be studying a little bit every day. You do not want to procrastinate. You cannot cram in nursing school. You're going to fail. Most nursing schools I know, in mine, we had to have a 75% or higher to pass the class. If you get a 74, you failed. You're going to have to study on a daily. Okay? If you bored, ain't got nothing to do, you need to be studying every day. The Saunders books has NCLEX style practice questions. I recommend you using those as a part of your study method. There's practice questions at the end of, at the end of each chapter or each section, there's practice questions. Then at the back of this book, there's a comprehensive test. So I don't think you need a comprehensive test until you are about to study for like your final exam, and of course studying for the NCLEX. But after each section, you need to be taking practice questions. And not only do you need to be taking practice questions or answering them, you need to be reading the rationales, because that's really where the learning comes in. Even when you get the answer right. When you get the answer right, you need to read the rationale, because that's going to reinforce what you already know. But especially when you get the answer wrong, because that's going to help you understand why you got it wrong. Participate in a small study group. I had a small study group when I was in school, and we were very productive. Don't have a big study group where y'all just going to be playing the whole time or on social media the whole time. That's going to be a waste of your time. You want to have a small study group. There was no more than 4 of us. Or actually 3. It was 3 of us. There's no more than 3 of us in our study group. And that's fantastic, because if you don't understand something, your classmate may understand something. And you really know that you know the material when you can teach it. So if you know it and they don't get it, you can teach it to them. That's going to help you, because that's reinforcing again what you already have learned and know, and that's helping them understand something, and vice versa. If there's something that you don't understand that they do, they can teach you. Y'all can bounce ideas off of each other. Y'all can quiz each other. I know we used to take turns writing everything that, like, brain dumping on the whiteboard. So small study groups are key. Do not do this by yourself. It's way too much information. Especially if you're doing an accelerated program. I did an accelerated program. So get you a good study group. When you go to clinical, you need to be proactive. Don't be sitting around acting shy. No. Get in there. I think it does kind of suck that sometimes a lot of nurses, they will use nursing students as PCTs to like clean up patients. I mean, that's not what they're there for, right? Nursing students are there to learn. So be proactive. Ask if you can reconstitute a medication. I know when I was on the floor, nurses, they be acting brand new. They act like they don't want nursing students. They be forgetting where they came from. I don't know why nurses be acting like that. I ain't act like that. When I had a nursing student, I loved it. I love having nursing students, because I am answering all of their questions. I'm letting them reconstitute medications. If they ask me questions that they can easily look up, I'm not giving them the answer. I'm telling them, you need to look it up. And I will show them how to properly look it up, because when you look it up, you're going to remember it. When somebody tell you, you're going to forget it. So I'm not telling you something that you can easily look up. So get in there and ask if you can watch, ask if you can do things, and ask questions that are not easily looked up. Also, when you're clinical, try to connect what you learned in class. It's really cool to see it in real life. You're like, oh, I remember learning about that in class. Try to connect the two. When you're at clinical, you need to be networking. You never know who your preceptor is, what manager is on that floor, that may be a potential job for you if you want to work there. The preceptor may put in a good word for you or write you a letter of recommendation. You just never know. So don't think about clinical like, oh, I gotta go to clinical. Think about clinical as an opportunity to learn, grow, and meet new people. 5, ask for help early. If there is something that you are not clear on, don't wait until the day before the test or 2 days before the test. As soon as you go over it, if you are having issues, ask your professor. Professors, they actually like when students go to their office hours, and when students have questions, that shows them that you want to learn and they love it. So ask for help early. If you need help writing your papers, utilize your school's writing center. I know we had a writing center and I didn't utilize it, although I probably should have, because my professor wrote comments on my papers like I need to consult the writing center to increase my level of writing at that time. So utilize that, and also get help with writing your papers early too, because you don't want to be procrastinating writing your papers and then turning some in late or getting a bad grade because you want to cram. Don't do that. The last thing is you need to take care of yourself. Take care of yourself. Work out. Try to eat healthy as much as you can. And because when you take care of yourself, you're more likely to be successful in studying, remembering information, doing well on your assignments, and then taking care of your patients. So be kind to yourself and take care of yourself. Those are my tips for surviving, thriving in nursing school. I hope these tips helped you. If they did, be sure you share with somebody. Be sure you subscribe for more content. Let me know what are some other videos that you all want me to do. Let me know in the comments. Did I miss anything on this list? What do you think? Let's have a dialogue. Until next time, take care and be blessed.